when you treat muscle-invasive bladder cancer, the standard of care currently is to give neoadjuvant chemotherapy followed by a radical cystectomy. However, we know a couple things. One, radical cystectomy is associated with a fair amount of morbidity, and certainly not something that we take lightly. Secondly, one of the strongest markers of success of these patients is pathologic response to the chemotherapy. Patients who are PT0 following chemotherapy have an 85% 5-year survival. So taking both of that data, we approached this idea of sequential therapy in that patients who pathologically responded following their chemotherapy, we offered them surveillance and potential radical cystectomy down the road if there was recurrence, and looked at this group of patients that we had over the past 10 years. And what we found is that there was a group of patients that did extremely well. They had no recurrences, they kept their bladders intact, had 100% cancer-specific survival. What we also found was that there's another group of patients that recurred and did not fare as well. So our original hypothesis that pathologic response could be a marker for us to approach sequential therapy and potentially avoid a radical cystectomy in these patients demonstrated there was a group that we can do this, but unfortunately it's not a strong enough or clear enough marker at this point. And until we get there, the standard of care needs to be neoadjuvant chemotherapy with radical cystectomy.